and how it applies in medicine in general, and especially when you deal with the multiple choice questions. And today, integrated MCQ has suddenly become a big buzzword. A reason it has become such an important buzzword is because we are all looking forward to a new pattern of exam in the next, which would be more comprehension based, more analytical based. And we are also, aware of the fact that the last year's NEET PG exam was far more clinically oriented than any previous exam. So we are all looking at a theme where even if you get a clinical question, it might have the roots in the basic sciences knowledge, or vice versa. You get a basic sciences question, but it has its roots in the clinical sciences question. So I thought today in this discussion, I'll give you an example of a question, and let's try to analyze the question together, and let's try to understand how an integrated question really feels like. So an integrated question usually would be something like what you see on the slide with me. This is a question which is a long stem. You see 4 choices, and you see a clinical vignette style of a question where you have a clinical problem with you. Let me, get the question in perspective for you. It seems at the outset that we are probably looking at a surgery question or a medicine question where you have a patient, a 56-year-old man, complains of at mealtime difficulty in swallowing. Radiological studies reveal mild cardiomegaly. A barium swallow is done and shown to you as an image. Which of the following is the most likely cause of this patient's dysphagia? And 4 choices are given. Mitral valve stenosis, pulmonary valve stenosis, regurgitation of aorta, occlusion of the anterior interventricular artery. Now what happens is when you look at such a question, it took us some time to read the question. And second thing that happens is, we are not able to pinpoint the subject that this question is from. Okay, and to make it more complicated, I am also attaching a visual in this paper. So this is the image given to you in this question. This is a barium swallow. The barium swallow is the barium study that we do for the esophagus. So you give a paste of barium sulfate to the patient, and he has swallowed it, and we're trying to look at the esophagus. So I want you to look at the esophagus, and you can see I have marked with a black arrow, something is pushing the esophagus posteriorly, and the esophagus appears compressed because of some extrinsic compression here. And we remember on the question when we read there was dysphagia. So let's read the question again. Now this time when I will read the question, I will try to read it as how a good student would read it, or how I would read it in the exam. Let's try to highlight the keywords. In a clinical vignette, the most important and probably the most useful line is the last line. So what I do whenever I'm looking at a long question like this, instead of reading the whole question, I would read the last line first. So the question is, which of the following is the most likely cause of patient's dysphagia? And there are 4 choices given to you. Now the key here is that even if I don't read the rest of the question, I know what has been asked. I need to find out the cause of dysphagia in this question. Okay. And second is, I also look at the 4 choices. I look at the 4 choices are mitral valve disease, pulmonary valve disease, regurgitation of aorta, and there is an occlusion of an anterior interventricular artery as the choice. These are the choices that I have to think about. Now, when I see the choices and when I see the last line, now I look at the images and the history to rule out stuff. That is my approach here. And this is what I want you to use most of the time. Another thing I want you to see is that please do not be attracted to the choice which has the longest answer. You will see many students are already thinking that the answer is D because they get attracted to the longest answer immediately. But that might not be the case always. And sometimes many people, when they do such an odd man out kind of a thing and they mark D as the answer, you might be up for surprise. So we saw how to read the question, we saw the last line, we saw the choices. Let's see the keywords. The question, the patient had difficulty in swallowing. Again, we see dysphagia in the end also, in the beginning also. And barium swallow. So barium swallow is done when we are thinking of something, a problem in the esophagus. But there is some mild cardiomegaly as well on a chest film. And all the 4 choices are related to some cardiac causes. So in a nutshell, the question is trying to ask us, which of the following cardiac conditions would lead to dysphagia? Okay, and now when I look back at the visual, and the visual was showing that there is some cardiac condition causing posterior displacement of the esophagus, and the esophagus is appearing compressed. Now this is the background at the question. Let's try to think about it like how you would think in the exam. To understand, let us look at a lateral chest X-ray. So when you look at this lateral chest film, in the front you see the sternum and back you see the vertebra. That is how you orient yourself. So the sternum is the anterior part, the vertebra are the posterior part. So let's try to understand the cardiac anatomy on a chest X-ray or on a lateral chest X-ray. Let me remind the listeners today that you might remember from your medical college first year days that the right ventricle is the anterior most chamber of the heart on a lateral film, while the left atrium is the posterior most part of the heart. So that is the background that I have. So right behind the sternum, I should have the right ventricle, and the most posterior should be the left atrium. Let's try to put some labels on. So when I put some labels on, let me bring the image in front now. So when I put some labels on, can you see right behind the sternum, I have written right ventricle, because that is the anterior. Above the right ventricle, I should be having right atrium. And I know the posterior most is the left atrium, and below the left atrium, we have the left ventricle. So we have some, perspective in mind. We have the idea that, okay, this is how the cardiac chambers would be, aligned. And I want you to think now, where is the esophagus located? So let me take a pen and mark it. Like suppose if I have to look at the esophagus, if I take a yellow color pen and mark the esophagus here, this is where the esophagus would have been. So now remember the barium swallow we saw, the esophagus in the middle was pushed backwards. Now I want you to all think over it now. Now we already have a picture in mind that the right sided chambers are more anteriorly placed, the left sided chambers are more posteriorly placed, and the most posterior is the left atrium, and we can see the esophagus is posterior to it, and we could form some perspective here, and esophagus is a posterior structure, right sided chambers are anterior. So this is the background that we have from our anatomy knowledge. So we have some clinical knowledge, some anatomy knowledge. Let's try to put them together into the question. Let's read the question again. So if I draw a line from the carina to the anterior cardiophrenic angle, if I draw a line like this, so the pulmonary valve will be located anterior to it. So pulmonary and aortic valves are anterior to the line that I have drawn. The mitral and the tricuspid valve will be posterior to it. So one of the choices is saying pulmonary valve stenosis, and we know from our discussion that we have done so far, the esophagus was posterior, and it looks unlikely that an anteriorly placed structure like pulmonary valve will cause a disease in the pulmonary valve will cause esophageal compression. Doesn't look likely, because pulmonary valve is more anterior and we saw the esophagus is more posterior. So I can quickly rule out that choice. Now let's see more choices here. One of the choices is saying occlusion of the anterior interventricular artery. Any coronary artery occlusion will lead to myocardial infarction. So what we are unable to think is, why would it lead to esophageal compression? So we know from our knowledge of anatomy so far that the most likely cardiac chamber which is going to compress the esophagus is the left atrium. And it doesn't make sense that you would have a left atrial enlargement in the occlusion of the artery and we're doing a barium to pick it up. So it doesn't really fit into the clinical bill. So I'm ruling it out. I see the next choice here was aortic regurgitation. Again, the aortic regurgitation would lead to left ventricular enlargement, massive left ventricular enlargement. Here we had mild cardiomegaly, which is not fitting into it. And again, the cardiac chamber that we are suspecting from our anatomy knowledge is left atrium. We are thinking it is the left atrium which is enlarged. So when I try to put all of this together, so now let's try to make one picture which gives us the entire idea. So this is the image given in the exam. We saw the esophagus and the mid esophagus. We saw the compression by something. We had cardiac history given in the question and cardiac chambers as history. Now on the other side, I have made a schematic myself where I have labeled the cardiac chambers. I have labeled the esophagus. We know it is the left atrium which is most likely to be the cause here. Enlargement of left atrium would lead to displacement of the esophagus posteriorly. And we also know that if it is a regurgitant lesion, it mostly would lead to more enlargement of the chamber, while the enlargement of the chamber would not be as much when you see in stenotic lesion. Okay, so again, when we put things into perspective, we had mild cardiomegaly, but esophagus was displaced posteriorly. So when we try to put them together, we are thinking of a left atrial disease. So maybe with this background, I want you to look at the choices again. So let's look at the choices again, and we are straight away able to look at the choice number A, which was mitral valve stenosis, and we are able to pick it up that a mitral valve stenosis would lead to LA enlargement. Left atrium is the posterior most structure, so that is the one which is more likely to compress the esophagus. And you know it from your, so if you notice, you know it not from your radiology knowledge, you know it from your anatomy knowledge as well, you know it from your clinical knowledge itself. So the key here is that somehow we have to put the things together into the question, and we have to find out what is the answer and what subject and what is the theme that the question is trying to ask me. So if I take you back to the question again, this was the question, if you notice. So again, when I look at it, even if I don't look at the visual, even if I don't look at the entire question, if I just read the last line, that which of the following will lead to dysphagia, I know that the left atrium is the posterior most chamber in the heart, and if it is enlarging, it is going to compress the esophagus, and mitral valve stenosis is in front of me, and I can actually get to the answer. So that is the beauty of an integrated question. In any integrated question, I want all the listeners to understand it is the final line in the question, it is the last line in the question which is the most important. So always look at the last line, look at the choices, So dysphagia could have so many causes. We might have, CA esophagus, achalasia cardia, a lot of other causes. But when I look at the choices, I know I am not supposed to think about malignancy, I'm not about achalasia. The question is about cardiac chambers. So when I am reading the question, I'm looking at the visual, I am trying to restrict my thought process to only a cardiac chamber enlargement which will displace the esophagus posteriorly, which will cause compression of it, and which can explain the entire question. So the key in a clinical vignette is last line is very, very important. Looking at the choices is very important. Particularly if the stem is even more long, I would always look at the choices before I look at the clinical history, so that in my mind I know what I'm ruling out. Because I'm sure you would appreciate that if most children, what they do as a mistake is they read the entire clinical question, then they read the choices. Now what happens is that now once you have actually seen the entire question and then you read the choices, then you realize that I have to read it again because you never ruled out anything. So in a longish question, the key is last line, then please read the choices, then go backwards and look at the question. And same holds true for the visual also. In the visual itself, you might have thought maybe it's an esophageal malignancy, and you might have thought maybe what test is this? You would have wasted a lot of time there. But you saw the visual, and in the question itself, it was saying barium swallow. We know it must be esophagus, and we saw there's some compression of the esophagus. The question itself was saying dysphagia. But the key here is that we are not looking at other causes of dysphagia. We're not thinking about dysphagia to solid, liquid. We're not thinking of motility disorders. We're not thinking of malignancy. We are trying to think about a cardiac disease because all four choices were cardiac. That helps you to restrict your thinking so that you're not overthinking into it. You're not wasting too much time. The key in longish questions is always the time that you spend in the question. Because if you spend too long a time in one question, which was actually straightforward, you would end up compromising your time for the rest of the questions. And another thing I wanted to point out to you is that how fast you are able to pick up keywords is a matter of practice. So please do practice clinical vignettes. And such clinical vignettes and even many more are now available in your DQB in NAMS question bank. We have around 2000 plus clinical vignettes already. And we have recently launched a special clinical vignette based test and discussion where we have covered such clinical basic sciences, clinical integrated questions, and I'm sure many of you who have already subscribed to that course would be enjoying it. And I wanted you to understand that this is something like connecting the dots. Like for example, during your MBBS years, we were accumulating all this information. You were accumulating information about the cardiac chambers, that a right ventricle is anterior, left atrium is posterior. In your clinical years, you learned about the barium studies and the barium swallows. But when it comes to putting it together, that is something like connecting the dots. And that is a theme which is nowadays more and more being asked in exams like USMLE. This is one of the proposed mechanisms that will be used in the next exam, the national exit exam, which is the talk of the town nowadays. And even the last year's NEET PG was full of such questions where you had to use the clinical statement to come to the basic sciences and vice versa. You needed to connect them. And this was one example that I wanted to use, and I wanted to showcase to you that this art of solving the integrated MCQ. I hope you enjoy this, and if you do that, please write in the comments and let me know that if you wanted to have any more clarification on the concept or any other question that you want to ask. I wish you all the best.